Welcome to our gross anatomy lecture series. I'm Gonzalo Zimboa. Today I'm going to take you through the gross anatomy of the heart. We are going to talk about the location of the heart, the covering of the heart, the borders and the surface of the heart, the chambers of the heart, and also the great blood vessels. So I'll start with the location of the heart. Where is the heart found? Now, we know that we have what we call the mediastinum. The mediastinum is separated into two. We have the superior mediastinum by the lower border of the T4. And then everything that is below the lower border of the T4, that is referred to the inferior mediastinum. In the inferior mediastinum, we have the anterior mediastinum, the medial mediastinum, and the posterior mediastinum. So the heart is located in the medial mediastinum. Right. So anterior to the heart, we have the body of the sternum, and we also have a part of the thymus. And then posterior to the heart, that is the posterior mediastinum, we are going to find the structures with a mnemonic called DEX. D standing for the descending aorta, A standing for the ischias vein, T standing for the thoracic duct, E for the esophagus, and S for the sympathetic tract. So the heart, its weight is about 200 to 300 grams, and it is surrounded by what we call a fibrous pericardium. So it is embedded into what we call a pericardium cavity. So the pericardium cavity, it forms the covering of the heart, or the external portion of the heart. Now, the pericardium cavity is formed by what we call the fibrous pericardium outside, right? The fibrous pericardium here is a thick, dense connective tissue that protects the heart from external damage. And also it will protect the heart, it also prevents the distension of the heart. So due to certain physiological effects, there are times where the heart is going to enlarge. So we don't want the heart to enlarge, because remember, in the mediastinum we have great blood vessels and other structures in a very tight space. So if we increase or enlarge the heart, it's going to affect the function of those surrounding organs. So this fibrous pericardium is very important. What innervates the fibrous pericardium? Right. The fibrous pericardium is supplied by the phrenic nerve, the C3, C4, C5 phrenic nerve. And also is going to receive branches that are called the pericardial phrenic arteries that are going to originate from the internal thoracic artery. So there are branches of the internal thoracic artery that are going to supply the fibrous pericardium. Right. So the fibrous pericardium here, it is lined. Let me use this blue marker. Fibrous pericardium is lined by internally by the parietal layer of the serous pericardium. So this parietal layer is serous cells that are simple squamous epithelial cells that are responsible for secreting the serous fluid that is found in the pericardial cavity. So the parietal layer is found underlying the fibrous pericardium and is also innervated by what the phrenic nerve and is also supplied by pericardial phrenic artery. So in the pericardial cavity, we have the serous fluid. The serous fluid, this is at the volume 30 to 50 milliliters, right? So where is the serous fluid coming from? It's being secreted by the serous membrane, the mesothelium. As we said, the simple squamous epithelium are the ones that are going to secrete this serous fluid. So this serous fluid is important because as the heart is beating, we don't want the heart to communicate directly with this fibrous pericardium. So the serous fluid has a lubrication effect that is going to lubricate the heart as it is beating, contracting, so that it will not communicate directly with the pericardium. Alright, so along the borders of the heart, the external surface of the heart, I said, we have the visceral layer of the serous pericardium. The visceral layer of the serous pericardium, it also secretes the serous fluid. And also, it is important because it's the one that covers the external, as it covers the heart. So it is often referred to as the epicardium. The epicardium. Now, so if we are to look at the layers of the heart, let's say that we have from this part of the heart and want to look at the layers of the heart. So the first layer, right? We are going to have the first layer that we have moving from inside going out. We have what's called the endocardium. So this one is the endocardium, right? So from the endocardium, we are going to have the myocardium. And between the endocardium and the myocardium, we have a jelly-like fluid that is called the cardiac jelly, right? The myocardium going outside, we are going to have another layer here that is called the epicardium. We said the epicardium can also be referred to as the visceral layer of the serous pericardium. Why? Because the visceral layer of the serous pericardium, if we add this visceral layer plus the adipose tissue, the combination of the visceral layer of the serous pericardium and the adipose tissue, because the heart is also surrounded by the adipose tissue, this one we are going to refer to it as the epicardium. So this is our external layer, right? So we have the endocardium, the cardiac jelly, the myocardium, and the epicardium. The epicardium, where does it come from? From the development of the heart. We know that we have what we call the sinus venosus. The sinus venosus is going to give branches, is going to give cells, mesothelial cells that are going to surround the heart. So the epicardium originates from the sinus venosus, and that sinus venosus is also important because it's going to give rise to the conducting system of the heart. So you need to take note of that. We are going to talk about it as we go. So these are the layers of the heart. So you need to take note of this at the root of the heart, at this portion, at the root of the heart, where large vessels, large arteries, large veins leave the pericardial cavity. You are going to find out that the pericardial layer of the serous pericardium will be continuous with the visceral layer of the serous pericardium. So here you have a continuous, it is continuous, right? So we have the vessels that are leaving the heart, and then we have vessels that are supplying or that are entering the heart, right? So we are going to talk about the internal structure of the heart. So there are very important vessels that we need to take note of, that are covered entirely by the fibrous pericardium. One, we have the ascending aorta. The aorta, remember, it is divided into three parts: the ascending, the arch, and the descending. So the part that is the ascending aorta is purely covered, is completely covered by what? By the pericardium, as well with the pulmonary tract. The pulmonary artery trunk is also covered by the pericardium. So you need to take note of that. So this is the covering of the heart. This is very important because clinically you're going to find out if we are to increase the serous fluid that is surrounding the pericardium cavity, we are going to have certain defects. Because remember, our heart to contract, it needs, for the heart to contract well, it must have minimum resistance from the serous fluid. Minimum resistance from the serous fluid. So if we are to increase the serous fluid, maybe there's hemorrhage, maybe we have blood in the serous fluid, causing the volume of the serous fluid to increase. We are going to compress the heart like this. So which means the heart is not going to contract. It's not going to contract very well. This will cause effects in venous drainage, right? Well, especially affecting the superior vena cava. Because the superior vena cava, it will be draining the blood from the head, neck, and the upper thorax to the what? To the heart. So you find that if the heart is not contracting, the blood is going to the blood is going to be located. It's going to cause, let me say, it's going to cause the superior vena cava and other superior veins to dilate, right? And this will also cause decrease in pulse rate in areas like the lower limb, the upper limb. Both in the upper limb, remember, we have the subclavian vein, the subclavian artery, the subclavian artery giving the axillary artery, and we have all those things. So the pulses that are obtained, right, in the upper limb, they are going to be low. Why? Because the heart will not be contracting very well, right? So that is the covering of the heart. Now we are talking about the borders and surfaces of the heart. We have 4 borders and we have 3 surfaces. So I'll start by the surfaces of the heart. So we have what we call the sternocostal surface. The sternocostal surface is the surface that is around the sternum and the ribs. So the sternocostal surface is going to have these features of the heart. We are going to have the right ventricle, right? We are going to have the right ventricle, the right atrium, and we are going to have the left auricle of the left atrium, and a part of the left ventricle is going to take part in forming the sternocostal surface. So that's the first surface that we have. And then we are going to have what we call the diaphragmatic surface here. The diaphragmatic surface. So this surface, it sits on the central tendon of the diaphragm, right? So we are going to have a ligament that connects, right, the diaphragmatic surface with the central tendon. That is the pericardial core-phrenic ligament. Is the one that is going to communicate with the central tendon. So what features are found on the diaphragmatic surface? We have 2 features of importance: the right ventricle, right, and the left ventricle. They are the ones that forms the what? The diaphragmatic surface. We have the posterior surface, or the best, right? The posterior surface is mainly occupied by the left atrium. So mainly occupied by the left atrium, right? And a small part of the right atrium. That is the part of when the inferior vena cava is draining into the right atrium. So that is for the posterior surface. What about the borders of the heart? The border, we have to know that the heart is pyramidal in shape. But the pyramid now this time is inverted. It's sort of like this. This, something like this, right? So this is pyramidal in shape, but the pyramid is inverted. Whereby we're going to have the apex of the heart, which is sort of like inferior to the base of the heart. Of the heart. So you find the apex of the heart is found on the 5th intercostal space, just 2 centimeters below the nipple, in the mid-clavicular line. And the apex and the base of the heart, that makes the posterior surface of the heart, is going to be made by the left atrium. Left atrium. Right. So, borders of the heart. Right. So we have 4 borders. Right. We said our heart is pyramidal in shape, but the pyramid is inverted, whereby you're going to have the apex of the pyramid below the base of the pyramid. So the apex of the pyramid, which is the apex of the heart, is going to be found in the 5th intercostal space, just 2 centimeters below the nipple, right? So in the mid-clavicular line. So the apex of the heart is found in that region, and the base of the heart is found in the posterior, but it is superior to the apex. So we have 4 borders. We have the right border, the left border, superior border, and the inferior border. So what is important for you to take note of, you need to know the structures that are making the right border, the left border, the superior border, and the inferior border. So on the right border, which means that we are going to have the right atrium. So the right border of the heart is made by the right atrium. Is it? Then the left border of the heart is made by 2 things: the left auricle of the left atrium and the left ventricle. The superior border of the heart is made by the left ventricle, where it gives rise to the apex of the heart. And then the inferior border is made by the ventricles, the left ventricle and the right ventricle. So that is what you need to take note of. The what? The borders of the heart.